I'll just start from the beginning. So this poster represents the work that we did exploring the relationship between exercise and colorectal polyps. As I've said, in the past studies have shown that physical activity and exercise have shown protection for colorectal cancer and polyps as well. The prior studies haven't reported if this protection extends to all ethnic groups in the United States. So does it help all white people, blacks, Asians, Hispanics as well? We assume yes, but we wanted to do this research to test that hypothesis. So as part of the research, we prospectively enrolled consecutive patients that presented for a screening colonoscopy at Bellevue Hospital, which is a municipal hospital in New York City serving primarily low-income and immigrant population. And when I say asymptomatic, I mean patients without any symptoms that could be related to cancer or polyps, such as abdominal pain or bleeding from the rectum or weight loss. And they also couldn't have any personal or family history of colon cancer or polyps. So once they agreed to enroll, we asked them questions about their medical history, the foods that they ate, the exercises that they did, and for how long they've been doing them. We also measured their height and their weight on the day of the colonoscopy. Then they proceeded to go to their colonoscopy, and we used the results of the biopsies for our data analysis. So regarding our results, we enrolled over 1,800 patients, and from there we removed anyone that was having any abdominal complaints or had any personal or family history of cancer or polyps. So that brought down the number to, here you can see in the first table we compared the group based on whether they exercised or did not exercise. And as you can see, a little bit over half of the 982 people reported exercising at least 1 hour weekly. They're very similar in terms of gender, age, BMI, but one difference we noticed was that the Asian people in the population were less likely to report exercise. This may be because they didn't understand the question well, or they may not think traditional forms of exercise for their culture would qualify as exercise here in the United States. Regarding exercise as protection or prevention against polyps and adenomas, you can see here in figure 1, this is all the subjects. The yellow bar represents people that exercise and the blue represents people that did not exercise. So you can see for any polyp, any adenoma, any advanced adenoma, there's a reduction in the prevalence for people that exercised, and that was significant. Then we looked at only overweight or obese people within the group, so anyone with a BMI greater than or equal to 25. And again, we see a similar pattern. Those that exercised receive protection against polyps, adenomas, and advanced adenomas. Regarding ethnicity, we found that Hispanics who exercised were less likely to have adenomas than Hispanics who did not exercise. And for black patients, we found that, again, those that exercise were less likely to have advanced adenomas than black patients that did not exercise. So, in addition, we did a multivariable logistic regression analysis to control for different variables, controlling for age, gender, ethnicity, BMI. And when we control for all those, you can see that exercise is still a negative predictor for colorectal polyps, despite these other potential confounders. So, in conclusion, we basically found that an active lifestyle, or people that exercise for at least 1 hour a week, be it walking or climbing stairs, received protection in their colon. They had a reduced risk of polyps or adenomas. And this is particularly true for at-risk groups such as blacks or overweight or obese people who normally are at increased risk for this disease. And we hope that in the future, public health initiatives will promote exercise as just another reason to be healthy. Not only good for your heart, your lungs, it's also good for your colon.